Hello everybody, welcome back to my channel. Today we have the topic that we begin discussing is the vertebral column. If you look at the list of the anatomy that is supposed to be with us for our anatomy exam, we see that the first ever point is the vertebral column and its general features. You have to differentiate between this point and the point just after that. It's always was a confusing process for me because the first point says vertebral column, and then the point after that just said the general characteristics of the vertebrae. So when you see the word column, here you're describing all of the features of this whole column. And those details that we'll be discussing today and learning about the vertebral column make up that first point. Now for the second point, when it says vertebrae characteristics, general characteristics of the vertebrae, they're saying the specific features of one vertebra that makes up the vertebral column. So that point set apart to begin with our first anatomy point. I wanted to make sure I go thoroughly through the system of answering when you're asked about a point in the oral exam with Professor Swirsky at the University of Wrocław, Medical University of Wrocław. So how the professor likes it, he usually likes it to be very general in the beginning. You have to tell them and show them with a little bit of introduction about the topic, not very direct into specific things, specific details. He loves to understand that you have a very well-rounded understanding of the topic presented. Okay, so to begin with, if you're asked vertebral column, directly in your brain, you have to imagine this image right here. And through there, you have to, in a way, have that strong mental image. So my advice for all of you guys starting learning anatomy, it's always important to have a strong mental image of the structure that you're talking about. So for example, if the vertebral column is the point discussed here, the mental image that I'm going to be putting in my brain is going to be this vertebral column, and directly I should know cervical, thoracic, lumbar, and sacrum. Okay, so as I said, cervical, thoracic, lumbar, and sacrum. So this is what I have in my brain before I start discussing any of those vertebral column features. Okay, so now I have that in my mind. I go into the functions. What is this column used for? What is it main contributions towards the functionalities and normal functionalities of the body? For example, it is the central axis of the body. It supports the weight. The body of the body. It also protects the spinal cord, as you will learn in the future that the spinal cord passes within the vertebral column. So this vertebral column protects and withholds the spinal cord inside of it. So this is the general aspect. Now you've done that part. Secondly, you'd want to talk about the structure. So what is this vertebral column made up of? It's from its name, made up of vertebrae. And they're saying here that for the sacral part and the coccyx, usually the vertebral structures are more bound to each other. They're not singular. Whereas in other regions of the vertebrae, they're always singular. As I will learn here, we're saying that in these regions, cervical, thoracic, lumbar, sacral, coccygeal, they're made up of a number of different vertebrae, and these have to be memorized and stated when you're asked about the vertebral column. So for the cervical, you have 7 of them, and they're all individual vertebrae. They're separate from each other. They have their unique bodies connected to each other by intervertebral discs. Thoracic is made up of 12, lumbar 5, as we can see, and then sacral is also made up of 5, but they're fused. Coccygeal 4, but they're fused. Okay, so until here, all good. Next, we can, or I don't know. When I was asked about this part, I did not mention this part right here, length or something like that. That's too specific. Try as much as you can to cover most of the general aspects, but don't go very specific. Just when you feel that you have a good knowledge hold of the topic, you can move on. But I didn't study the length, for example. Next, we are going to talk about the curves of the vertebrae. This is part of the characteristics that the vertebral column has. So you see what I mean? Like, we go first discussing the functional generally, then we go into the regions, how many vertebrae in each region, and then continuing on to be thorough with our description. We mention the curves that you see in the column structure. And those curves are quite easy. Can be confusing in the beginning, but it's a very simple idea. Just know that the first step of human growth is a baby. So that's any structure within a baby of the vertebrae in a baby is a primary structure. So anything after that, so with growth, the vertebrae evolves and starts to have secondary curves. Okay, so any part of the vertebrae of the vertebral column that has, when we're talking now about the adult stage, that has the same shape as the baby's vertebrae, primary vertebrae, is called primary. Okay, so look at this image right here. These two images are just mirror reflections of each other, so that you guys are not confused. Okay, so we just switch this and it's this one. Okay, so look at those parts. I'm just going to use my pen here. You have this part right here and this part right here. They look exactly the same as the primary level. So they're called primary curvatures. And this part is the thoracic, and this part is the sacral, as we see right here. So primary curves are thoracic and sacral. To be specific with your description about primary curves, and that's what Swirsky sometimes focuses on, is that using of medical science terms to describe what you mean by a primary curve. Okay, so just to be very simple, you'll say they are concave forwards. Okay, what does that mean? That forward in this part right here, it's concave. Okay, same with the sacral part. Forward, okay, is concave. And as I told you, they're present at birth, retaining the forward concavity of the fetal vertebral column. So this concavity is basically retained from the structure of the vertebral column of the baby. Okay. Secondly, the secondary curves evolve later in growth, and they're not parts of the vertebral shape in a baby or a fetal stage. So they're different. They shape differently from the primary, so they're called secondary curves. And these parts are the cervical up here and the lumbar down here. Okay? And to be specific with it, we say secondary curves is the cervical and lumbar part, and on the forward edge of it, anteriorly, here, just below the head, and between the thoracic and cervical, the lumbar, they are convex forward. And I think once you say this, your message will be delivered to Professor Swirsky, and I don't think there'll be anything fancy that you have to say after that. This is the coverage of this topic. I think it'll be very sufficient for you to just mention those things. You can go ahead and mention the length. You can, if he stops and looks at you, sometimes he just pauses to see if you have more things to say. You could probably go ahead and read a bit more to grab some more interesting facts about the vertebral column, and that's what I do, and just add them there so that you're not quiet looking like somebody who doesn't have anything else to offer from answer. Okay, so yeah, so this is the first topic. I hope you enjoyed this video, and if you have any questions about this topic specifically, please message me on my private Instagram or in the comments below. I would love to answer all of your questions and help you reach to a stage where you're satisfied with covering this topic. Plus, I loved using this guide during my studying because it's very, very beautiful to just have the descriptions in there and the drawings on the other side, so that I have images when I'm studying, because images are important for anatomy. Okay, and yeah, so if you like this guide or book, we actually sell those. If you are located locally within Wrocław, we sell those out to students. They just have to reach out to us. And if you like it, please message me on my direct Instagram. I'll just put it below. And I hope you good luck, and I hope you an amazing time studying this beautiful subject, because it's one of the most amazing things I've studied actually. And passing this course was a very, very nice thing to do. So this is the end of the video. Hope to see you guys in upcoming ones.